Okay, we are live, and I'm Sherry coming at you from Odyssey Pets in Dallas, Texas. We have a very special guest today, Dr. Emily Stein, who created Teef. I wanted to highlight this product in particular because it is so effective. We're right now at Odyssey Pets. We're celebrating all things oral health for pets. So, because February is National Pet Dental Health Month, um, this is live, so you can't ask questions while we're here. But if you're watching this in replay, you can always send questions to Odyssey Pets through our Facebook page or Instagram or info@odysseypets.com, and we'll give the contact info for Teef at the end.
Great.
So, Dr. Emily Stein, how are you?
I'm a little cold. It's a little bit cold up here in Minnesota.
Oh, wow. Yeah, it's 70 degrees here today.
Oh, don't even go there.
That's not like short sleeves. So tell us a little about yourself. How did you get into the pet industry?
Yeah, so my doctorate is in microbiology. I geek out over things that most people can't see, but you can definitely smell their effects. And I really fell in love with microbes for two reasons. One, they could kill me, and two, they make the world happen. And so that fascination really fueled my fire. And I went to Berkeley and spent 6 years learning how they work in biofilms and what stresses them out and how they survive stress. And it's super cool. And then I went to Stanford and spent 7 years as a research fellow in rheumatology because I wanted to understand more about how they're involved in causing chronic inflammatory diseases, particularly those that affected my family. So that's my background.
Wow. Wow, that sounds more important than the pet industry, actually.
Well, the pet industry is the coolest, most fun part of what I do.
Yeah, it is fun. It is fun. That's for sure. So I recently read that 80% of dogs begin to show signs of oral disease by the age of 3, which was pretty astonishing to me.
Correct.
So why is oral health important for pets?
Okay, so poor dental hygiene can shorten a dog's lifespan almost by 1/3. So if you don't take care of your pets, your cats or your dogs or your horses or your own teeth, each time that happens, disease, I'm going to whip out my disease my handy, show and tell. And what happens, if you'll notice below the gum line, there are just teens of microbes that a veterinarian cannot, or a dentist cannot scrape out. And so that's what causes the disease process. That's why dogs lose teeth. And it's because they attack it's called a periodontal ligament that holds every single tooth intact in the mouth. And so imagine just bacteria every single day, every minute of it, every day, even at night while you're sleeping or your dog is sleeping, going after and attacking that ligament, right? If it's the wrong kind of bacteria. And they get fed a lot by the foods that we feed our pets. And so I got into this whole game because I had my grandmother and a rescue dog almost died due to dental hygiene problems. So that is why it's so important. It's linked to cardiovascular diseases, kidney failure, lower GI problems, malabsorption problems, and now even dementia in dogs and in humans. So it's a big deal. These bacteria once they gain access into the body through the gum tissue, they can go anywhere and cause problems.
Wow. I just recently lost a dog to dementia and he only had like one tooth in his head left.
Yep.
But yeah, I didn't even put 2 and 2 together. That's crazy.
Well, scientists are putting 2 and 2 together. It's taken a while, but we're learning.
So I guess you already answered the question, what your motivation was. So
my motivation is I don't want anybody else to have to go through the pain and suffering and expense that I've had to go through. And so that's what pulled me into refocusing my attention on trying to solve this because I was astounded by the approaches on the market that are currently being used and the false assumptions that folks have when it comes to dental hygiene and for humans and for pets. And so I happen to know how bacteria work, and they're the root cause of this problem. And so over the past 13 years, I've really tried hard to learn as much as possible so that we can come up with the most sensible, safe approach possible for our pets.
So I have a question. Since it starts below the gum line,
Yep.
what does like what the vets do, the teeth scraping and all that, does that actually do anything? It's not going to get the bacteria down below.
It doesn't. It does a decent job at extending the length of time before the problem becomes really bad. But their equipment is, you can't pull teeth out and reinsert them to clean thoroughly enough, basically. And so they're doing the best that they can with the tools that have been developed so far. But it's just not enough. I mean, if it were enough, 80% of dogs and 92% of middle-aged cats wouldn't have the problem. And it's just because of the bacteria. It's so tiny, and they go right in there and they burrow below the gum line and they make themselves a little home in a biofilm, and they duke it out with one another for survival. And so our whole goal is to really improve who lives down there, because if you actually have, so we're talking about hundreds and hundreds of billions of microbes in the mouth, right? And so below the gum line, there are less, but they're the ones that are causing the problem. And so who you have living down there is actually driving disease or health. And so we're trying to repopulate those good guys below the gum line that really help benefit dogs and cats and humans.
Quick side note, while I was thinking about it, I believe, and you can correct me, I believe that a healthy diet can help oral health in the long run. So if you're feeding like Little Caesars or something that has corn syrup in it, that's not going to help.
No.
So yeah, a good quality food will help in the long run.
Yeah, and things like ingredients that are making their way into pet food these days are like, I've noticed a lot of pea protein or sweet potato and things like that, which is great for gut microbiome health, awful for oral microbiome health. And so
well, I'm a big proponent of raw, but that's like a whole other rabbit hole. So
a whole other rabbit hole. And raw, I'm also a fan of raw.
Yes.
Because it grows the kind of microbes I want in the mouth.
Exactly. Yes. And there's like natural enzymes in the meat, right? So
Yep.
Well, if anybody has any questions about that, they can always, message me. So, because I could talk all day about pet nutrition, but I don't even know if I've shown this. This is what we're talking about, y'all. This is the package, Teef, Protectin 42.
Yep.
And there's like a kit in here. So how does this work?
Yeah. So I got the kit. I don't, it comes in the bag, and it comes with an instruction manual and this teeny tiny, I don't know if you can see that, little spoon. And that's a single dose that goes in the water dish every day. And the powder is, I know it's small. Good things come in small packages. There's no filler. There's no ingredients. It's just the active ingredients. So there's nothing that's inactive in this, which is why it's a little bit goes a long way. And it's human grade, so you feel free to try it too. And you just literally take this scoop and put it right in the water dish every single day. Make sure you wash the water dish every few days to keep the water dish in good, clean stead, which also helps facilitate faster results for your dog. But a single scoop is all the bacteria need to start to really turn over and improve the oral microbiome in your dog or cat's mouth.
I was going to say, this is good for cats too, right?
Yep, it's good for cats. It's not optimized for cat. We're actually getting ready to launch a clinical study with some veterinary partners in Australia and the United States to make certain that we've got the perfect cat solution. And we hope to launch that later this year.
But right now, if like, because my cat drinks out of my dog's water bowl, it's fine if he does that.
Absolutely safe for cats. And there's actually veterinary derived evidence to suggest it works pretty well for cats. It's just, I'm the scientist, so I'm not, it's not perfected yet for cats. Right. It was originally built for dog.
We did have a question come in. What if you have a house full of dogs? Do you use the same amount?
Oh, yeah. Okay. So it's all about dose-driven time to results, which gets to a very common question that we were asked about how long does it take to see results. And it completely depends on what you feed your dog and how much.
My next question, yeah.
Yeah, and how much you dose them. And so for a multi-dog home, because this stuff is human grade, made it in the United States from ingredients in the United States. It's not the cheapest. We're trying to get the cost down as much as we can, but it's tough these days.
Well, you got to pay for quality,
Yeah. And we have, yeah. So, but it's the best we can possibly make. We source around the globe, and this is the best we can do. And it's a little bit expensive. So to be as cheap and cost effective as possible, we have some customers that take a scoop, put it in a water container, mix that up, and then pour it in multiple water dishes every day. And the time to result for any given dog in your pack will be a little bit longer to see the obvious results than what I would see if I just dosed this entire scoop that was consumed every single day in a dog. That's a faster result, for instance. But it also depends on what you feed them, how severe the disease is in their mouth, because it's a long process of unwinding, and beyond a certain point in the dental process, you can't unwind that damage that's been done, but you can save any teeth remaining. And even if your dog doesn't have any more teeth, I promise it's so important because the bacteria still live below the gum line and they can go into the body and cause other problems. So even if you have a puppy, an older dog with no teeth, it's really important to maintain a healthy microbiome in the mouth.
So you're saying even if you're not getting like the full dose, anything helps at this point?
Anything helps. Yeah, it might take you 3 months to see noticeable reduction in redness and swelling of the gum tissue, or an improvement in breath might happen in 2 months instead of 1 month that we're normally used to seeing. And plaque and tartar would probably soften in 2 to 3 months instead of the first or second month. It just depends.
So I used to use this other powder made by another company, and they said that the effectiveness of it after you add it to the water, it's only good for like 6 hours. Is that the case with this? Like, no, after
this is a prebiotic. So these feed bacteria that we want to grow in the mouth of dogs. And okay. So they're already active. They'll be active for, it does have a vitamin, which turns the water a little bit yellow. And that vitamin is very potent and has a shelf life to it. When exposed to light, I would give it a 24-hour activity.
So do you recommend that we change the water bowl every day?
Yeah, I do. Otherwise, you're just
dump it out, wipe it out.
Yeah, you're feeding the good bacteria in your dog's bowl, but you really want to feed the good bacteria in your dog's mouth.
Good to know. Good to know. I'm actually very bad about cleaning out the water bowl. I'm lucky if I do it once a week. So I'm going to start doing that.
I highly recommend it. We've had customers that never wash their dog bowl, and I'm like, oh my gosh,
it's like slimy.
Do you wash your own glasses? Like, it's a concept.
Yeah, no, it gets really slimy. It's gross. Yeah. And if you take a paper towel and wipe it out, you see like the bacteria.
Yeah.
So we have another question. Does it also help the visual you see? I think she's asking, like, will it help with, like, will oral health help with vision too?
Oral health helps. Okay, so the mouth we're finding is connected to the bladder indirectly, lower GI very directly. So we have reports of customers whose dogs have a lot of tearing. That clears up a little bit too, because the mouth is connected to the sinuses, which is connected to the orbitals, and I don't want to go into anatomy, but everything is connected. Ears, eyes, nose, throat, it's all connected. Brain. And
Right.
these bacteria burrow really, really well. And they basically have these mechanisms. I won't go into detail because your eyes will glaze over, but they can burrow through our gum tissue, our blood vessels, our blood-brain barrier, and go wherever they want. And so that's why I want to not have those particular guys growing in the mouths of our dogs. And I'm trying to instead facilitate the growth of these probiotic-like strains like lactobacillus and lactococcus and all the other good guys.
Definitely. She just commented, that's good to know, but she was talking about the tartar.
Tartar. Okay. So here's a falsehood 101. Tartar does not correlate with gum disease. Tartar is just tartar on teeth. And yep. So we have always been taught to pay attention to tartar, but more and more we're realizing, even particularly I'm talking about what they're learning at these really prestigious universities that deal with human dental, is tartar you don't necessarily have cavities if you have tartar buildup. You don't necessarily have gum disease if you have tartar buildup. It's about who lives in that plaque that dictates whether or not you have cavities or gum disease.
That's good to know. I also have a person, wow, y'all are really active. Thank you. That asks, if I use this, do I still have to brush teeth? Because I'm bad at that. And let me tell you, dogs don't like it.
No, my dog, I've tried. He's 2 years old, and I think I went through 6 toothbrushes because he chews them all up. He refuses. It's too invasive. And just imagine, like my grandma, when she was in assisted living, it's so invasive to have someone else shove something in your mouth constantly. And so, we try to do the least invasive thing as possible, but the most effective, which is put it in drinking water. I personally don't want to. So it's debatable whether or not brushing in human dentistry is effective. Fluoride seems to be more effective than brushing itself. So, but I can't ethically tell people not to brush. So, but I do give my dog chew toys. So he's got a mechanical way of stimulating gum tissue activation and does the mechanical kind of removal of just, gross plastic.
I'm a huge fan of raw bones. We saw a lot of raw bones.
Good.
That has the natural enzymes on there too, and it's perfect to get that chewing action.
Yep.
One more question. So back to how much to dose. If you just have one dog, you would only fill the bowl with what they would drink in the day?
Ideally.
Okay. So
yeah.
You don't want to like overfill, put 2 gallons down and then put this stuff in it. Yeah.
My goal is to get this tiny scoop's worth of powder in their mouth, as much of it in their mouth every day as possible.
Okay.
And if you have an older dog or a dog with more GI issues, it's better to slowly start them out, because I mentioned the mouth is connected to so many more things than we realized that there's going to be a shift, and as the bad guys start to leave, they don't make it easy on the dog or on the human, and so they can make you might have a looser stool for a day or two, or you might the dog might urinate more frequently for a couple of days as the bad guys start to transition out. And because, like I mentioned, they are intimately associated with the neuronal system, the gut, and bodily functions of animals and people.
Okay. This is, You're making me change my routine at home. I feel like a bad dog mom.
No, we're all learning together, right?
Yes, yes. All right. If anybody has any other questions, now's the time to throw them at me. But I am also going to give away a Teef kit. So if you're watching live, I'm going to give away a Teef kit. You got to answer a trivia question, and the first person to answer is going to win. And then we'll go back. We have a couple of questions, so we'll go back to that. Let's do trivia real quick, you guys. So in the beginning, I said that by the age of 3, a percentage of dogs in our population have bad oral health. What is that percentage? First person to answer, let's win a Teef kit. And these are $29.99. I sell them for $29.99 in my store.
Less than $1 a day.
That's a good way to put it, actually. Yeah.
Cheaper than a dental cleaning.
Yes, and less stressful. Oh my gosh.
Mm-hmm.
All right. There's Recycled Pomeranians and Skipperkeys Rescue. Yes, a rescue group just won this. So that's awesome.
That's awesome.
That's super awesome. And she's the one that has like multiple dogs in her house right now. So yeah, obviously she takes care of a lot of rescue dogs. So that's really cool. So let me back up real quick. If I refill the bowl 4 times a day, is it okay to give all in one bowl, or better to give a bigger bowl with a whole day's worth?
Bigger bowl, but don't go out and buy a bowl. Like I said, you can just take this single scoop and put it in a pitcher that you might have and just keep on refilling it. Put it in the fridge though, because again, there's no preservatives. So you just keep it in the fridge and then you can just take it back out and refill their bowl. That's
a really good tip. And then is this good or bad for a dog with a heart murmur? Does this affect heart murmurs?
It's not contraindicated for any disease states or meds. I originally, these ingredients also work for human, and my grandma was on a lot of different meds after her stroke from her dental problems. So doesn't interfere.
Okay. All right, good. All right, well, we're gonna wrap this up. So if people want to learn more, it's her website, Dr. Emily Stein's website for Teef is teefhealth.com. Are you guys on Facebook or social media?
We are. Instagram and Facebook. If you just Google Teef Health, you'll pick us up.
Awesome. Cool. And then if anybody has any questions for me, you can contact us through the website, odysseypets.com. We are located in Dallas, Texas, but I'll answer your questions, sure. And if you want to sign up for our newsletter, you can text OPBigD to 22828. And I want to thank you so much for taking the time out of your day to do this. This has been very informative. I really appreciate it.
Yeah, thank you so much. And go Dallas.
Yeah. All right. Well, you be safe, and thank you so much. And everybody, please be safe.
Thank you, guys.